So how would I define a patient who's going to benefit the most from ruxolitinib? That would definitely be a patient who's got a large spleen, who's got symptoms from the spleen, but it may also be a patient who doesn't have a large spleen but has quite disabling disease symptoms. Some of our patients are very much bothered by night sweats, by cachexia, marked weight loss, and by profound itching. So I have a very good example of a patient who had been unable to take a bath or a shower for a number of years due to his disease, and the most striking thing for him, and the thing that pleased him the most, wasn't that his spleen was shrinking and that he could eat better, but actually was that he could then take a bath or a shower for the first time in 5 years. So for me it would be symptomatic patients with splenomegaly. I don't think we're at a point at this time where we would be considering patients who have low risk disease, who don't have any symptoms, and who aren't suffering because of their splenomegaly. I would also be cautious in treating patients who start with a low platelet count because we don't have adequate safety data in terms of their management, but there is an ongoing trial to address that issue. The results of Comfort 1 and Comfort 2 indicate that we are now entering a new treatment landscape with a greater potential to offer something that actually makes a big difference to patients with myelofibrosis, both in terms of, yes, their spleen size, but also in terms of their quality of life, and is probably the first step to altering the natural history of this condition. So myelofibrosis in the past has been called the malade of misery, and it was always a very difficult, quite depressing field to work in, because if you couldn't offer your patient a transplant, then you were really essentially palliating them and were trying to put a sticking plaster, which often wasn't very effective, over some very debilitating symptoms. So it's a really great privilege, and it's a huge pleasure to be able to offer patients a treatment that makes a very dramatic and rapid difference to their quality of life. So it's very gratifying.